Good morning. Thanks for joining us today. Good to see you all. So as a community, we're starting to see our cases rise again in Snohomish County. Dr. Spitters will go into much more detail on that, but this should really give us all pause. We really do have the power to push our numbers back down. We've done it before, and we can do it again, and that's really essential to get our economy open again. So we need to make another surge. It's what we've said from the beginning: maintaining social distance, washing our hands, wearing a mask. And if everybody would do these things, our numbers would be going back down again. So it's also this year particularly critical that everybody gets a flu vaccine. We want to really eliminate any chance or reduce the chance for the flu to compound our problems with COVID-19. So it's been really impressive. Very, very proud of our county and all our residents. We've done great. We've pushed the numbers down twice now, and really wish there was an easier way through this, but really our health of our loved ones is best protected by following those protective measures, and that's really the only way we're going to get our economy back up and running at full speed again. So with that, I'm going to turn it over to Dr. Spitters from the Snohomish Health District.
Okay, thank you, Executive Summers, and good morning, everyone. And I think Executive Summers wrapped up in an excellent summary fashion what I'll go through in a little bit greater detail. But those are really the key messages for us all to carry with us every moment. And before I go into the COVID, I just want to reiterate his endorsement of influenza vaccination for all of us, especially those who are at highest risk for severe disease, hospitalization, many of the same underlying conditions that increase the risk of COVID. And we certainly don't want to see a convergence of influenza and COVID in the fall and winter months, competing for a variety of resources, most notably hospital resources. So I urge you, if you haven't done so, get in touch with your primary care provider to get vaccinated against the flu for this year. And if that's not available, or your primary care provider doesn't provide the flu vaccine, which some do not now, or you don't have a primary care provider, contact your local community clinic about the possibility of doing that, or you can go to virtually any pharmacy in the region and get vaccinated against the flu there. So rotating back over to COVID, I would like to share my screen and just show you a couple of slides to go a little bit deeper into the details behind. I think I got the wrong screen up there that I wanted to share. Okay, hopefully you're seeing a slide that says comparing the target case rate versus total cases. And this is just to respond to some very common questions about how it is that we calculate this rate that is charting our progress and our challenges as we go through this COVID-19 pandemic. Gonna go back here. So again, our target rate is to have a community-wide rate of fewer than 25 cases per 100,000 residents over a 2-week period. And so the first thing when we think about, well, how many cases would that be in Snohomish County? Well, if we look at, if we're counting per 100,000 residents, how many groups of 100,000 residents do we have? Well, at an estimated population of 830,000, that would be 8.3 groups of 100,000 people. So consequently, our allowance to, if you will, to come in under that rate of 25 would be 25 times 8.3, or 208 cases over any 14-day period. Now, how does that compare with what we're actually seeing? So when we calculate that rate, which we do on a rolling basis, every Monday, we go through from the prior Saturday back 2 weeks, back 14 days, add up all those cases that have been reported, and then divide that by 8.3, and we get our current rate with 455 cases, about double that target number. We divide that by 8.3 and we get the current figure of 54.8 for the 2 weeks leading up through last Saturday, October 3. So our case rate right now for that 2 week period is roughly double the target rate. And so this again just shows you in graphic form what Executive Summers was referring to, that we've been through 2 waves. The first one, we did get down below that threshold. That's when we moved into phase 2. We're all now familiar with the course of the second wave, which declined through toward the middle to late part of August, early September, and then we kind of stalled out in the 40s and now have turned back up we went from 42, I believe, to 46 at last week's report, and now we're up to the 54.8. So again, it just speaks to the fact of the persistent challenge that this virus creates and the need for us all to engage in those preventive measures that Executive Summers summarized, and I'll be going into detail again in a moment. Now, just to share with you, we also do periodically, about twice a month, we gather up the data and then look at case rates by zip code. So we do the same calculations that I was showing you, but instead of the denominator for the case rate being 830,000, it's whatever the population, the estimated population is for that particular zip code. So all those outlines you see there are zip codes. And in the lower right-hand corner is a legend that shows you the case rates: greater than 90, 60 to 90, 30 to 59, and then less than 30. So when we look at the county, the first thing we see is that the highest rates tend to be along the I-5 corridor, especially over the long haul, if we accumulate all cases over the whole pandemic. But if we just look at the 2 week period, the most recent 2 week period we have on record, we can see that things have moved around the county quite a bit, and there's virtually almost no area in the county that's below 25. There's, you know, out toward the Cascade Peaks, there's this region here, and then down by the King County border, a couple of small areas with less than 25. But the vast majority of people, all of us, live in parts of the county where we are above that target. And so I think that that's just a reminder that none of us are special, in that this situation affects us all, and we all have a role in contributing to preventing transmission. So speaking a little bit more about this, we haven't spoken about the R0, or the reproductive rate of the infection, in a few weeks. And I just wanted to go back to that because I think it really underscores the why of these preventive measures we've been discussing. So again, the R0 is the average number of new infections created by a single infection. So if it's greater than 1, that means there's more infections for every new one, and the incidence increases as it does now. So although we don't have a calculated R0 for our community, we know it's greater than 1. Our goal is to get the R0 less than 1, meaning that every case results in fewer than 1 new case, and then over time, things will diminish and we'll see reduced rates. So 3 main factors go into calculating that figure. First is the number of exposures, or the number of contacts we have. Next is the transmission risk per encounter. And then the third one is how long someone is contagious. So obviously, the longer they're contagious, the more opportunities they have to come in contact with people. So if we break that down a little further into the impacts of preventive measures on each of those factors, we see a lot of things that each and every one of us can do every day to bring that reproductive rate down. So in terms of the number of contacts, if I don't have someone within 6 feet of me, they're not a contact. So keeping away from people that are outside your household and social distancing. I work in a partly occupied office building here, but we all always stay 6 feet away from each other. Limit social gatherings. Really try to reduce the number of people you come in contact with for any reason, work, social, what have you, outside of your household contacts, and definitely no more than 5 in a week. But frankly, the more we can do to just keep it to our households and necessary encounters, the better we'll do in flattening this third wave and getting beyond it. And then just keeping our interactions shorter, smaller. And then of course, for those of us who are sick, either confirmed or suspected to have COVID, staying away from others altogether. And that even means in not only not going to work, not getting together with people outside your home, but also trying to stay away from the people within your home, sort of isolating yourself within your home. And then for those who have been exposed to others, again, staying out of society until that 14-day incubation period is passed. And so that's, again, the difference between isolation and quarantine is isolation is the removal of sick people from exposing others. Quarantine is the removal of people who have been exposed and who could become ill and expose others. So quarantine is kind of preventing potential cases from having unwitting contact with others before they get sick. Then in terms of transmission risk, if we all wear a face covering, then as I'm speaking right now, I'm generating a cloud of droplets that if somebody was in my room, especially within 6 feet of me, that they could inhale. And so wearing a face covering captures and stops the generation of that cloud of droplets, some of which are large and fall to the desk or the ground quickly, others which can remain airborne for minutes to hours and be inhaled by others. So wear that cloth face covering to reduce the cloud of droplets that you generate that other people can breathe in. Washing hands frequently as we touch things and move around. Not only can we infect ourselves, but we can move germs from one place to another, spread them around, and cause others to get sick when they touch the same thing. So if we're all washing our hands frequently, we reduce the amount that we expose ourselves and the amount that we move things around and can cause others to be exposed. Avoid touching your face because the portals into the body for this virus are the eyes, the nose, and the mouth, and as well as the breathing. While we can't stop breathing, that's why we wear face coverings, avoid touching your face. And then cleaning high-touch surfaces, as I mentioned earlier, it's sort of it's the inanimate version of washing our hands off and trying to keep everything clean to eliminate the virus that can move around. And then for those of us that work in high-risk settings where we're facing patients or other people who are at high risk to transmit COVID, then we protect those. And that's particularly, but not exclusively, healthcare workers and first responders who are directly facing patients and people in the public. Sadly, for duration, meaning to shorten the duration of infectiousness, we don't have anything for that right now. For many infections, another thing I work on, tuberculosis, we treat people with antibiotics, and within a few weeks, most of them are no longer infectious. We don't have, well, we have some treatments for COVID-19. None of them are definitively curative, and their impact on transmission has not been assessed. So we don't have that tool in our arsenal. So really it's those first two columns that we really need to pay attention to, each and every one of us. So with that, I'll bring us back and pause and turn it back over to Executive Summers.
Thank you, Doctor. Do we have any questions today? Dr. Spitters, are there any trends in recent infections, age groups, activities, Labor Day, large spreader events Some Republicans in the state are pointing to low hospitalization rates as a cause to move forward with reopening. Can you talk about the threat of overwhelming hospitals and how quickly that can happen?
So really, three questions in there. Let's take them one at a time. First, what is the epidemiology of this recent increase? You'll recall the prior wave was primarily young and middle-aged adults, but predominantly led by young adults in the 20 to 29 age group. They are still the highest number of cases. The biggest increases across time have been seen in adults 30 to 69 years of age. Children, no increase. Teenagers, no increase. And fortunately, thus far, among older adults above 70, no increase. Beyond that, we're a little bit far out from Labor Day for that to be a cause of this. We are a couple of weeks out from those smoke events, which brought people indoors. And then, as you'll recall, or my recollection is, once the smoke cleared, then temperatures kind of came down and outdoor activity is really ratcheted down. And so people are spending more time indoors. And so that's going to be with us for several months now, probably for the next 4 to 6 months. We're all more or less indoors most of the time. So it really speaks to the importance of doubling down on all these prevention efforts, because we don't have the infinite dilution of outdoor air and ultraviolet light from the sun to help us fight the virus. So all the more important to focus on good ventilation when you're indoors, trying to keep the air moving and bringing in fresh outdoor air, and whenever possible, wearing face coverings when you're not only with your household members. Those are really key. Beyond that, no signals about any particular gatherings. I have to confess to you that although we ask, I'm just, human nature, tends to be that they would not report engaging in a gathering that that's not permitted or is discouraged. So we're not getting reports of that. When we ask about it, I can't tell you whether that's true or not. We're all interested in preserving hospital capacity. And, we've been doing pretty well even through the second wave, because the older adults were less affected in this last wave. So, we got up at the peak to around 30 hospitalizations at any one time, countywide, related to COVID. Then it came down into the low teens as the second wave bottomed out. And then the week before last week, we saw a little increase in hospitalizations from the low teens up to the mid 20s. Now we're in the low 20s and watching that carefully. But certainly, I've used this analogy before, but it really is like a little bit like driving on ice, that once you realize you're going too fast, it's too late. So we really are needing to tap on the brakes, not in any significant way. I think in this, our tapping on the brakes is those preventive measures and avoiding gatherings. But given the increase and its early nature and what we've seen with prior waves, I'm certainly hopeful that we can flatten it out. But in the event that we don't, hospital capacity is going to be a concern. So it seems a little bit, optimistic to focus on, opening a lot up right now in the midst of an increasing rate and uncertainty about where hospitalizations are going and to what extent the elderly will be affected by this third wave.
So, Doctor, do we know the current R0 number for the county?
Yeah, the organization that works with the Department of Health that calculates the R0 does not calculate it for county specific, just King County, Eastern Washington, and Western Washington. And last time I looked a couple of days ago, it's above 1, but you don't need to be a statistician to know that where our rates are going up. But we're somewhere up around 1.1, 1.2. But often our calculation of that figure will lag behind what we're seeing because the calculation of that figure relies upon that data. So I would just say, we use R0 more as a framework for looking at how we as a community can interrupt transmission. But I would just keep your eyes on that graph that we've been looking at every week.
Here's a question, I think, for both of us. What impact will President Trump's comments that COVID-19 is no big deal have on your message that it is? Well, I think it's obvious to most people. We have over 200,000 people in the United States dead, a million or more worldwide. The world is pretty much shut down. I was talking with Boeing yesterday. There is no travel. There's no demand for aircraft. That's what they're dealing with, but that isn't created here locally or even in the United States. It's worldwide. So the CDC has been very clear that wearing masks and social distancing and taking those precautions can really help us turn this thing around. But we've just got to keep the message going and point to the obvious numbers that are right in front of our faces. So it's unhelpful, but it is what it is. Doctor?
Well, that's right. And even locally, we've got 211 people have died. Half of those have come from nursing homes, people sort of in a setting where they're, at the mercy of living and relying on the help of others and not able, in many cases, not able to choose that they're there. But the other half have been people out in the community, most of whom have had underlying conditions, but a lot of disease out there, with 8,000 cases, 200 deaths, all the impacts that Executive Summers has mentioned. And then I just also, we really don't know the long-term effects, but some of the information that's emerging is concerning, even for those who don't get hospitalized or don't die. When we look at people who have had infections and look at their heart muscle, there's a high frequency of inflammation of the heart, and that's not good. And even with people who weren't particularly sick, didn't get hospitalized, you do an MRI of their heart and you see heart inflammation. And what the long-term implications of that are, we don't know, but they could include complications of heart rhythm or the circulation of the heart over time. So that's just one example of, what we've seen is a big deal, and it could in the long run be an even bigger deal than we currently understand. So the value of prevention and trying to stem this thing as much as we can cannot be overstated.
So Doctor, you're going to be talking to school leaders later today. Is your guidance going to change because of the increase that we're seeing? And Archbishop Murphy is hoping you'll give them the okay to bring juniors and seniors back, will you?
Yeah. Well, I think first, out of respect to our school leaders, I think it's best for us to have that conversation and then speak with the community at large about that. But certainly, what I can tell you is that we're in the medium range of risk that's set up in the framework by the State Health Department and the Governor's Office. And at this point, as you know, we haven't issued any changes and recommendations. And as you stated, we are speaking with the school leaders later today, and then we'll follow up to let you know the outcome of that conversation.
Okay. Any more questions? We've got a couple minutes. Last chance.
Hey, hi everyone. This is Carrie in the Joint Information Center. I'm not seeing any more questions at this time. It looks like we've got one, so we'll answer this last question before wrapping up.
We keep seeing schools all over reopen and then cases break out, is it really safe to reopen them now?
Well, a couple of things. One, safe is a relative term. There's, few things in life are either completely dangerous or 100% safe. So it's relative levels of assuredness that what we're doing is a reasonable balance of risks and benefits to the people involved directly in the community. And that's what we're trying to work through. That's what the state health department and the governor's framework for K through 12 learning is based upon, the science underlying that balancing of risk and benefits. And it's, I think, the best roadmap that we have going forward. Cases will occur in schools. We haven't had a lot, even thus far. Locally, we've had some cases in schools, mostly among staff. No outbreaks in any of the schools that I'm aware of thus far. Just a handful of cases per week, and then we get involved to try to take the measures to prevent spread. We're all aware of what's happened in some other settings. We're just hoping that whatever path we choose forward, we have the measures we're using to protect the students, the staff, and the surrounding school community and the community at large are appropriate. And that's what that framework's for. It's based on science, and again, it's the best recipe we have for moving forward.
Thank you, Doctor.
All right, well, this is Carrie again. Thank you all for joining us this morning. We will go ahead and wrap up, but please do stay tuned for future media availabilities. Thanks.
Thank you.